It can be super easy to fall into the trap of relying on processed or sugary foods for quick energy, especially when you're dealing with cravings or fatigue. But these foods will actually just spike your blood sugar levels and leave you feeling even more drained later on. So basically, it'll give you a quick boost of energy and then you'll crash. Instead, we want to be focusing on whole, nutrient-rich options that actually just give your body the fuel and energy that it needs. I know that figuring out what to eat during pregnancy can be so overwhelming with all of the advice out there, but it really doesn't have to be complicated. Small, consistent choices every day can make such a big difference. So for example, if you are pressed for time in the morning and you want to go for that quick sugary cereal because that's what you're used to eating, and let's be honest, cereal when you're pregnant hits different, but maybe pairing that cereal, if you still want to eat it, with some hard-boiled eggs as well, so you're getting a little bit more of a balanced diet. Or even if you just have a pregnancy craving and you're wanting a cookie, for example, or some ice cream, make sure that if you know you're going to be eating those things, that you also are eating and prioritizing a really balanced and nutrient-rich dinner. So before we dive into eating during labor, I want to briefly mention postpartum nutrition, which is just as important as your nutrition while you're pregnant. After giving birth, your body needs extra care to heal and to recover. Holistic nutrition for postpartum focuses on warm, nutrient-dense foods that are easy to digest and deeply nourishing. Think bone broth, soups, and stews, foods that replenish your energy and help you rebuild your strength. Many cultures actually emphasize warm foods and rest for the first 40 days postpartum, and for good reason. These foods provide the nutrients that your body needs to heal while also supporting lactation if you're breastfeeding. I'll be doing a separate video for all of that on postpartum nutrition, so make sure to stay tuned for that, but I did just want to mention that support during postpartum is essential. Now let's talk about eating during labor, which is honestly a topic that's surrounded by outdated myths and policies. You might have heard that you shouldn't eat or drink during labor, but this advice is actually based on outdated practices. Back in the 1940s, doctors forbade food and drink to patients undergoing surgery because of the risk of aspiration while using general anesthesia. Since most women were actually sedated during labor at this time, this nothing by mouth policy extended to childbirth. But here's the thing. Modern anesthetic techniques have made aspiration so rare that it's not even statistically notable. Even the American Society of Anesthesiologists declared it's safe for women to eat and drink in labor back in 2015. Despite this, many hospitals still restrict eating and drinking during labor, relying on IV fluids instead. But medical research does not support this policy. In fact, in many other countries, women are allowed to eat and drink during labor, and their outcomes are just as good, if not better, than in the US. Medical research simply just doesn't support the nothing by mouth policy nor the routine use of medical IVs. So if you're planning to eat during labor, focus on light, energy-rich foods that are easy to digest. Carbohydrates are especially important to maintain your energy levels. Think about snacks like bananas, toast, oatmeal, or energy bars. Honestly, whatever is easy to eat and snack on that will also give you some energy. Staying hydrated is just as crucial, so make sure to keep electrolyte drinks like coconut water or broths on hand to prevent dehydration. In my Blooming Confidence course, I go even deeper into this topic. You'll learn about the routine use of IVs and the best foods to eat to keep your energy up and support your birth experience. Been wondering how to approach nutrition during labor and what your other general options during labor are? Then this course has all the evidence-based guidance that you need. So to wrap up, the food choices you make during pregnancy, labor, and postpartum play a huge role in your energy, your recovery, and your baby's health. Prioritizing nutrient-dense foods isn't just about eating well. It's about setting yourself up for a positive, empowered experience. Thank you so much for watching this video. If you found this helpful, be sure to like, subscribe, and let me know in the comments what other topics you'd like to hear about. And don't forget to check out my Blooming Confidence course, which is actually on pre-sale. It's packed with literally everything you need to know to feel prepared and empowered for birth and beyond. Blooming Confidence will be linked in the description below this video, so again, please be sure to check that out. I will see you in the next video. Bye!